You are watching the Doctalk show.
Talking dental health, in particular dental caries, or what they call tooth decay. How can we prevent ourselves from getting tooth decay? How do we protect our teeth from getting weak due to this bacteria and the constant eating of sugars? So, Dr. Nelson, children, anyone can get dental caries.
Yeah.
How can we prevent ourselves from getting them in the first place?
You have to ensure that your teeth are brushed well, brushing using the right technique, just like Dr. Deborah will demonstrate, and then also brushing at the right frequency, preferably twice a day, and taking a period of about 2 minutes every time you brush.
People forget to brush before going to sleep.
And actually, it's the most important time.
It's the most important. Why is it the most important?
It's the most important time because when we go to sleep, there's a tendency of salivary flow to decrease. And we've already seen the benefits of saliva. Saliva has the buffering effect, getting rid of the bacteria, the bad bacteria that are going to cause the decay, the cleansing effect. So once the salivary flow has fallen, then you're short of those really good benefits of saliva. So it's important to sleep having brushed your teeth well.
And this bacteria is most active at night.
Yeah. When the saliva is little.
Yes.
Okay.
So you just try to avoid everything and brush before bed.
So I want to listen from the experts themselves how exactly we should brush our
This
teeth.
is my mouth, and this is my toothbrush.
Which
now,
has toothpaste.
Yeah, that has a reasonable quantity, not a lot of toothpaste. You're not supposed to use a brush for 6 months. You use them when the bristles are flat. You brush and you're brushing something else, not the teeth. So this is my mouth, and this is the brush, the right brush. Now, I hold my brush at roughly 45 degrees to the teeth.
So there's like an angle.
Yeah, there's an angle. Of course, these are estimates. You don't need to hold it flat. You hold it at an angle to the teeth. Then there are two options of brushing the right way. It can be in circular motions, or up, down. Why up, down? Because when you lift the brush, it lifts the gums. Then when you pull it down, it removes all the dirt under the gums and pulls back the gums onto the tooth.
Okay.
Unlike our normal way of brushing, that kind of brushing, the horizontal, you're pushing the gums to this side and you're pushing them to this side. Remember, the gums are soft tissues, so they have blood supply, and these bristles, you see them as bristles, but they are rough. They injure the gums, so in the long run, you notice the gums shortening, and you think your tooth is growing long, yet actually it's the gums running away from the tooth.
They're being injured.
Yes, they are being injured, yes.
Brushing technique.
Yes, and some people complain a lot about, doctor, my gums are bleeding. They bleed every time I brush. Basically, it's because of the habit, the brushing habit. Then also, avoid the horizontal, because these bristles have a tendency to cut at the neck of the teeth. If you notice, many people have depressions on the sides of the premolars. If you notice, these teeth that we brush from the sides, we use a lot of force, so you end up having pits, and in the long run, yes, in the long run, you come to us complaining of sensitivity. Remember, the neck of the tooth is connected.
So the neck of the tooth, what do you mean?
The neck of the tooth is that junction between the gum and the crown. The crown is the part that you see. Now, at that neck, it's closer to dentine. Remember, dentine is the sensitive part of the tooth.
It's the inner part of the
Yes, the inner part of the tooth is sensitive. So the more you expose it, the more the chances of you feeling sensitivity when you take hot or very cold. So
pain.
Yes, pain. So the right way to brush is up, down. You go everywhere. Up, down, or small circles. Small circles. That is in all the surfaces of the teeth. When you're done with the lower teeth, still at an angle, you open your mouth. it is very important to brush on the inside of the teeth. If you notice, most times this inside part of our lower teeth gets a lot of dirt. Because there are many salivary glands here that pour saliva. And saliva is not just water. It comes with a lot of minerals. So if those minerals find dirt, they mix up and form those hard things. The plaque. The calculus, that is the harder component. Now, you have to brush inside. Then when you're done with the inside, you go to the grooves. The grooves are the chewing surfaces. Now, yes, these grooves have a tendency to retain a lot of food, especially the sugars. Now, we are talking about caries here. These are called pits and fissures. You find that if you don't clean these grooves so well, you will notice staining. The grooves tend to darken, and from darkening, you just notice them pitting, like forming holes from there, because they become retention surfaces for what? For food. If you don't brush them, definitely you'll get those holes. Then the last part, after brushing all the teeth surfaces, it is important to brush the tongue. Most times we think we are fine, and yet it's the tongue that causes most of the bad odor. I think we'll talk about that later. Bad odor. So the last part of brushing should be the tongue. Then, surprisingly, it's not good to rinse. Yeah.
So
after brushing, don't rinse. Just spit, but don't rinse. Because this, remember that toothpaste has components that we want to what? To take time on the tooth and give it its functions. So don't rinse immediately, just take your time.
So the other cleaning method, which is widely advocated for, is using dental floss. Dental floss is just a dental thread.
Yeah,
Dr. Deborah also demonstrates that. It can come as a roll, or it can come already pre-packed and it's already demarcated for you. So it is very important to use it to clean in between teeth. And when you're using it in between teeth, you just insert it in the teeth, then pull out as you're pulling towards the surface of the tooth, the surfaces in between the teeth. You don't sew. It's important to take note that you're not advised to sew, because to sew, some people put it there and then it's like they're forcing it and moving it in between the interdental spaces. Once you do that, then you're going to injure the gum and the bone in between teeth, which will result into pain. You just drop it in there and then dislodge it out. That's how it does. You shouldn't
swing it sideways.
exactly.
You just get a strand.
We have our teeth.
Yeah.
Our tooth here.
This is just one type of floss. There are those that come hooked.
With a hook.
Yeah, with a hook. But this is the type that you just tear off. So you cut a reasonable length and roll it on your index fingers. And just imagine this is my mouth. You move the floss between the teeth, just moving in and out, in and out. You don't sew, like he said. You don't sew.
Okay, that is what
Most times we make that mistake. Now, in
what
the
happens
process
if you
of
do that?
sewing, you're actually damaging the gums. The gums are just in between the teeth. And right below the gums is bone. So the deeper you sew, the more damage you cause to the gums and the bone. So it's just a matter of in, out, in, out. You make sure all the teeth, as far as you can go. Most times people have issues with the behind teeth, but trust me, if you're used to the system of flossing, you won't, yes, you perfect it with time.
Okay.
And please avoid toothpicks.
Could there be some foods which you'd advise people to eat?
Yeah, maintaining teeth and in general oral tissues, just like the general norm is, just have a balanced diet, but more emphasis on the fiber foods. They're really so beneficial to the teeth and the other tissues of the oral cavity or of the mouth. Yeah.
Okay, so eating lots of fruits and
Fruits.
drinking lots of
Drinking a
water.
lot of water.
Okay, and remember to brush your teeth very well and to use dental floss, all these will help prevent dental caries. So
You are watching the Doctalk Show.
Insights from a malaria specialist.
This message goes for health workers. You are the link and the person who can influence people who have got malaria. A person who has come sick to you with malaria is the best person to speak to, because that means the person has failed to keep themselves malaria free. It means that person is not following care practices and is being bitten by mosquitoes. So you need to explain to them, just the way you do when you get a person with a sexually transmitted disease, you tell them to bring their partners. In the same way, a person who has come with malaria means in that house there are mosquitoes, and it means there is another contact. That malaria of that person, a mosquito has picked it and will give it to another one. Or this person will return to the same home where nets are not being used, will burden you again 1 or 2 months later. So you need to focus on communication to this person to adapt practices. So apart from just treating and saying go, adapt a medical practice whereby you are mindful about public health and closing the transmission chain. This should be the new approach to managing a malaria patient.
You are watching the Doctalk Show.